drying their eye out. Because if you lived in Arizona, you would be a lot worse than by living here, because the environment has a significant factor on how dry your eyes are. If you go into Walmart to go look for something, they run the air conditioner at that place high, full bore, 24 hours a day, and the air in there is extremely dry. And then you're staring to look at something and not blinking. So then people, as soon as I go in there, then I have trouble seeing. I can't see and your eyes are dried out. So this is the same thing about that dry management. So this is the new hot topic about dry eyes. So this is the LipiFlow and LipiView machine. There's only a few of these still yet in the United States. We were fortunate enough to have one of the first 20 machines that were ever built or made. And so I've had people fly as far away as Seattle to come here to get treated. And so the great thing about this equipment, even though it's very expensive, is that we can now diagnose exactly what's wrong with your dry eyes. Before it was just a guess, try this and see you later, try this, see you later. It was always just shooting in the dark and hoping something works. Now we don't have to do that. So now I can measure how salty your eye is, so I know how much liquid layer you have. And now this machine measures the outer oily layer of your tear film down to microns of level. So by scanning in, and this takes a scan of your eye, it's a movie, so we actually see how well you blink. And while it's doing that, it's now measuring how thick is the oily layer on the surface of your eye. So now when we get that, we know exactly what kind of dry eye disease you have and how we're going to treat it. This one's on this one side is about 90 microns in thickness. And so that's pretty close to normal. About 100 and 110 is normal. On the other eye, it's 55. So they're half of normal in the left eye, in this person. Unfortunately, I have people come in with 20s who have almost no oil to their tear film at all. And so they have severe dry eye problems. So now we know ahead of time what's wrong with your tear film, that your meibomian glands are not producing any oil, and this is basically what happens. So you saw that thick stuff. So as your inflammation over years of time, those glands started producing a little worse, a little turbid stuff, then it got thicker, and then it got to the point it plugs up. So now those glands are plugged, they can't secrete any oil anymore, and after a while, those glands will atrophy and die, never to be healthy again. So the longer this goes, your chance of recovery gets less and less and less, because you're going to slowly, over years of time, lose another gland, lose another gland, lose another gland. And so that's what happens. So if someone has a reading of 30 or 40, they're 3 times below normal. And so they don't have very many glands that are working. Some that are secreting just a little. Some are plugged, still alive, but plugged, and some are dead and gone. We now can, this LipiFlow machine is the first and only FDA-approved treatment for meibomian gland disease or dry eyes due to this. So ahead of time, we know whether you're going to be a great candidate for the procedure because we measured what was there before. We're not guessing and hoping it works. It works in 90-something% of the time. So this is the apparatus. And so this part here goes inside your lid. Your lid goes in between this, and there's a little balloon here that goes on the outside of the upper and lower lid. And so this heats up to 106 degrees. And so just like if you put butter in a pan, when you heat it up, it becomes more liquid. So it heats up to 106 degrees, and this balloon then pumps and squeezes and cleans your glands out after it's heated them up. And so I showed you where the glands are located inside your lid, so that's where the heat is applied, directly to where the glands are. This is what it looks like. It's not painful. When we brought the machine in my office, I have a little bit of a dry eye problem. I said, okay, we'll find out what it's about. So I sat down, and I was the first person we treated with my machine. And you almost fall asleep during the process. It's like going to the spas. It just gently heats your lids up to that 106 degrees, and it gently pumps and squeezes the glands and cleans them out. So if the glands that are recoverable, we can now get you back to what those work again. And this is what it looks like. So we have this part inside, and then there's where the gland is, so it heats the gland directly, and then this pumps and squeezes and cleans those glands out. And it's 12-minute long, it's a 12-minute treatment. So it takes 12 minutes to do the whole process. So this is just some studies that were done. And when you have to do a study with the FDA, you can only do that treatment and nothing else. That is, these people weren't allowed to do any of the other things we're going to talk about, how to treat dry eyes. So after a year or so, because people ask me, how long is this going to last? I don't know. Just to be honest about it, I don't know. I know that after a year the study was done, that a small percentage of people started having symptoms coming back again. But they were allowed to do nothing other than just to treat them. And so the same disease that caused it to happen is still going to be smoldering on, and you're going to go right back to where you were before. So we have to do things as a maintenance so we keep you healthy longer. And so the machines have only been around a year. I've had mine since June. And so we don't know, by doing what I'm doing now, how long it's going to last, but I think it's going to last a lot longer. So these are just studies that show that it's effective. And so there's been really no damage from having this done. There's no significant pressure. It's all insulated where the heat isn't there. So basically, the LipiFlow is the only approved procedure to treat dry eyes. There's nothing else that's been FDA approved that says it's safe and effective. But this is only part of what we do. But this is the newest, latest thing. So now we're going to go over a little bit about what we do. So you come in, you have dry eyes. So it's like I said, I look, see how dry your eyes look, see if the glands are inflamed. You have blepharitis along with it. So we do the whole exam of how your eyes look. We take a sample of your tear to measure how salty they are. Then we put you on the LipiView machine that measures your oily layer. So then I sit down with you, I have all this data. So then I can tell you, this is why your eyes are dry, this is why they bother you. And the symptoms from dry eyes vary dramatically. Got people who don't have a lot of symptoms to people who have severe symptoms that can no longer work, drive a car, read a book, do anything because they're putting tears in their eyes every 10 minutes and they're in horrible pain. And by looking in your eye, I can't tell you because I have people who have fairly looking, pretty bad dry looks as far as the looks of it goes, who don't complain too much, and other people who just have the beginning of it who complain a lot. And there's 2 or 3 reasons for that. One reason is that the first time, if you ever put a hard contact lens in someone's eye, back in the old days where hard lenses were common, they're crying and going crazy and nuts. And they have to build up a wearing time because they can't tolerate those things in their eyes. And then 3 months later, they don't know they're in there. Because your nerve endings have been desensitized by having that hard lens rubbed up and down in your eye all the time. So you get like it's not a callus, but your nerve endings just get numb to that. Same thing, as that salt level goes up, because there's no fish that live in the Dead Sea because it's too salty. As the salt level goes up, it burns your nerve endings to where you no longer feel what's going on. So your symptoms can vary off the board, from mild to horrible, and it can be anywhere. And when the most common thing is, doctor, my eyes are burning and watering, and I look, they're dry. Can't be dry, they're watering all day long. Well, they're watering because you've irritated your eyes so bad that your crying gland is pouring out water. So you're just running a loop. They dry out, and then your eye says, we're hurting here, we need some help. Then it waters. It dries out, and then it waters, and you just go on a loop. And so, just like if you got something in your eye, or you scratched your eye waters. So any inflammation or irritation gets to a certain point, your eye is going to water. That's all it can do. It can do nothing else. So the symptoms could be red, itching, burning, scratchy, itchy, foreign body sensation. I wake up in the night, my eyes are stuck together. I mean, it could be all kinds of variety of symptoms about dry eyes. So once we find out what's wrong, then we design a customized treatment based on what's wrong with your particular tear film. So if you don't produce enough liquid, then we have to treat that you're not doing it. So common things that you might be in that case would be to put you on Restasis, which is a medicine that advertises on TV all the time. And for certain people, that works really well. Other people, if you have bad meibomian gland disease, it's going to do 0 for you. So if you have bad meibomian gland disease, I'm not putting you on Restasis because it's probably not going to work that way. So you can plug up your tear ducts. So you have ducts to drain the tears from your eye into your nose. That's the reason why when you cry, your nose runs. So just like if you had a river with not enough water in it, you would dam it up so you can have more water. So we can put tiny little microscopic plugs in those openings and block the drainage from your eye, so that now you have more moisture because it has nowhere to drain to. And the first time we do that, we do it with temporary plugs that dissolve in a week. So that way you get to say, okay, that made them feel a lot better than you would put a permanent kind in that's not going to go away. But then you get a trial. You're not stuck putting them in and then I hope it works. If it doesn't work, I did all this, but you get the trial first. So those things would be something if you weren't producing enough liquid, plus then you're going to use tears to help supplement your tears. We have different kinds of tears. There's over 50-something types and brands of teardrops on the market. There's thick ones, there's thin ones, there's all kinds of different ones. And even the big companies like Allergan and Alcon, they have 3 or 4 different kinds of their own kind of teardrops. And so that's where we can help is before, and I was in the same boat, before I knew what was wrong with your tear film, I just said, here's a sample, go try it, this doesn't work, try another one. So we now tell people that, okay, if you don't have enough liquid part, then you need to get one that is basically designed just to be the liquid portion. So this one's a preservative-free tear. If you have a big bottle of teardrops that has chemical preservatives in it, if you're using it a lot, you may want to not use that kind because you're putting chemicals in there all the time, and those chemicals can irritate your eye. And you should never use Murine or Visine or Clear Eyes that says takes the red out. That chemical that squeezes those blood vessels is very irritating to your eye. It makes them white and bright and shiny for a while, but it's long term is not good for you. So we have this, we have teardrops in the office now, so we actually sell this. This is a really good, plain, regular, nothing special tear with no preservatives. Then, if it turns out, and another thing that we do now, especially if you have the meibomian gland disease and that kind, is we now put people on Hydro-Eye. Hydro-Eye is an omega-6 fatty acid from black currant seed oil. And people say, I'm taking fish oil. Not the same. It's great if you're taking fish oil and your doctor wants you to do that. You should continue doing it. And like I said earlier, there are some studies with large amounts of fish oil that has made people's dry eyes better. But this does a unique thing. Omega-6 fatty acids from salmon or from fish is actually probably inflammatory. That is, omega-6 probably causes inflammation. Omega-3 is anti-inflammatory. So when you get a fish oil, you've got to make sure there's a lot more 3 than there is 6, because if not, you're not going to get the benefit out of it. So omega-6 fatty acids from an animal source can actually cause inflammation. This has, from a plant, it's been shown, and it's scientifically been shown, that what this does is that you have different chemicals in your body that your body produces in a reaction to different things. Like when you get sunburned, your skin produces prostaglandin, and I forgot which one it is, and that makes your skin turn red and burn. That's a prostaglandin. There's also prostaglandins that calm down inflammation, and that's called prostaglandin 1. This is the strongest stimulus of the production of prostaglandin 1, anti-inflammatory prostaglandin in your body, that they have found so far. And so this calms your eye down. It takes a while to work, maybe a couple of months to kick in, but it's been working so well since like July or so that I started taking the stuff a month ago myself. There's just too many people say they come back and they're better. It's called Hydro-Eye.
Is it effective in Sjogren's and all?
Yes, because it's anti-inflammatory. And Sjogren's is you're in a Sjogren's. It's an autoimmune disease where you're attacking your own cells. So this is an anti-inflammatory. So it should work as well.
Where do you buy it from? Drugstore?
You can only get it through a doctor's office,
Like you.
like me or some other doctor who carries it.
It's called Hydro Water.